You know, this pandemic is new territory. It's tough for us as adults, but I can't even imagine what it's like for children. Chaplain Saundra Rector from GBMC joins us now. Thank you, Chaplain, for joining us.
I'm so glad to be here. Thank you for having me.
You know, what do you say to families with, small children? You know, how can we help them cope with the school closings and the fact that they can't go outside or play with their friends? What can we do to help them?
Yeah, it is a time to be especially creative. I think we had such harried lives before this hit, and so many families with young children were just constantly trying to juggle their schedules and get somebody to baseball practice or ballet or swimming or after school activities or all those different events. And now it's time to appreciate the time that we have together, to slow down, to really get to know your kids in light of the time that we have together. So I think it's an opportunity to really just spend some real quality time with each of your children, if you have multiple children, to spend time doing what they want to do rather than running them from object to object to object of all the things that they have on their schedule. And take time each day just to say, I love you. I'm glad we have this time together. It's not what we normally do, but we're going to make the best of it.
You know, Chaplain, you were talking before we started about the healthcare workers who are on the front lines. What do you say to keep them going and to feel positive and keep upbeat when they're seeing what they see every day?
I think just really trying to appreciate each and every day, every act that they do. I see the healthcare workers coming out of the rooms, whether it's the nurses, the residents, physicians, the environmental services, our housekeeping crew, food service, and just to tell them how grateful we are for all we're doing, to acknowledge how very hard what they're doing is, and to just kind of join them in that and to say, we see what you're doing, we know how hard it is, and we're so grateful that you are doing such a wonderful job. So we just really try to affirm their entire experience and not try to sugarcoat it, because what they're doing is incredibly hard, but to say, we know this is hard and we are so grateful that you are as gifted and giving as you are.
If you need help, where should you turn?
The people out in the community or the people on the staff?
People on the staff, people in the community, either.
Well, as I say, they certainly here in the hospital, they turn to us and they turn to other resources that we have here to offer support. We have ability to interface one-on-one with people, keeping our social distancing, but to also do debriefs with different units and teams that are working in really difficult circumstances where they can process everything they're experiencing. If you're out in the community, if you have a parish or a synagogue or a mosque or a community center that you're a part of, reach out to somebody there. There's got to be some leadership involved. Turn to your family, turn to your friends. There are so many resources, and so many people are home now looking for ways that they can be engaged, be involved, give back. So pick up the phone and give someone a call.
All right. Chaplain Rector, thanks so much for what you're doing, and thanks for joining us for this interview.
Thank you.